Welcome to my SN Pharma online classes. Today I am going to discuss about adrenergic receptors. Here, adrenergic receptors, it is mainly classified into alpha and beta receptors. Alpha, it is subdivided into alpha 1 and alpha 2, and beta, beta 1, beta 2. Here 1, nothing but stimulatory. Alpha 1, beta 1, nothing but stimulatory in nature. Alpha 2, beta 2 is nothing but inhibitory in nature. अगर 1 आ रहा है बोले तो आप समझ लो स्टिमुलेटरी इन नेचर है, एंड 2 आ रहा है बोले तो इनहिबिटरी इन नेचर है. हियर alpha 1, they are stimulatory in nature. Mainly it is located in the blood vessels. Alpha 1, they are mainly present in the blood vessel. If it is stimulated, result in vasoconstriction. Because it is stimulatory in nature, result in the vasoconstriction. And it is also found in the smooth muscles of genital urinary tract. Nothing but contraction. Then it is also present in the urinary bladder, mainly on the trigone muscle. These muscles present in the lower base of the urinary bladder. It helps to push the urine out from the urinary bladder. Here, these receptor, they are mainly found in the trigone muscle. If it is stimulated, result in the contraction of this trigone muscle, result in the no retention of urine inside the bladder. Next, it is also found in the vas deferens in the seminiferal vesicle, result in the ejaculation, means increases in the ejaculation. It is also found in the glands. It is result in the, if stimulation of this alpha 1 receptor, result in the increases in the secretion. It is also present in the liver, result in glycogenolysis. Lysis is nothing but breakdown, means there is a breakdown of glucogen to glucose. Next, alpha 2 receptors. Alpha 2 is nothing but inhibitory effect. They are mainly found in the pre-junctional nerve ending. We know this is the pre-neuron, this is the post-neuron. These alpha 2 receptors, they are mainly present in the pre-junctional nerve ending. If there is a more transmitter is released, these receptors are activated, responsible for inhibition of release of neurotransmitter, further neurotransmitter. Then it is also found in brain due to the inhibitory nature, which decreases the sympathetic flow, means there is a decreases the release of norepinephrine neurotransmitter from the sympathetic nerve. Then it is also found in the pancreatic beta cells. Due to its inhibitory action, it inhibits the release of insulin. And it is also present in the platelets. It is also present in the platelets, leads to increases in the aggregation of the platelets, because on the platelets fibrogen receptors are present. Due to the stimulation of this alpha 2 receptor, there is a stimulation of fibrinogen receptor, means if activation of this fibrinogen receptor, more fibrinogen is bound over the receptor, result in aggregation of platelet take place. Then it is also found in the blood vessel, leads to vasodilation, because of inhibitory in nature, leads to vasodilation. Next, beta receptors. Here beta receptors, again it is divided into mainly 3 parts: beta 1, beta 2, beta 3. Here first one, beta 1. We know beta 1 is mainly found in the heart, in the different area, like on the SA node, on AV node and ventricles. Here SA node, Yes, SA node, it contains beta 1 receptor. If this beta 1 receptor is activated, we know one is nothing but stimulatory in nature, result in the increases in the rhythmicity, means increases in the generation of impulses. Next, beta 1 receptors also found in AV nodes. This leads to increases in the conduction velocity because AV node is responsible for conduction. If the stimulation of this beta 1 receptor which is found in the AV node result in more conduction, means increases the conduction velocity. And it is also found in ventricles, result in more contraction of the ventricle take place. And it is also found in juxtaglomeruli of the kidney, juxtaglomeruli cell of the kidney. If there is a poor blood supply or reduced blood supply to the kidney, what happen? Renin is activated, means renin is released from the juxtaglomeruli of the cell. And here what happen? Due to this renin, the angiotensinogen is converted to angiotensin 1. The angiotensinogen which is present in the liver, which is converted into angiotensin 1. Again, angiotensin 1 is converted to angiotensin 2, and angiotensin 2 is converted to angiotensin 3 by the enzyme angiotensin convertase enzyme. When this angiotensin 3, the main role of this angiotensin 3 is increases in the blood pressure. These are all about beta 1 receptor. Next, beta 2 receptors. Here beta 2 nothing but inhibitory. They are mainly found in smooth muscles like bronchi, leads to bronchodilation. Because of inhibitory in nature, dilation of bronchi take place. In the blood vessels, vasodilation. In the uterus, relaxation. In the pancreas, increases the glucagon secretion. In the detrus muscle, leads to relaxation. And in the eye, increases the aqueous secretion. These are all about adrenergic receptor. Thank you for watching my video.